Yes.
Okay.
Oh man, my battery died.
Oh no. Keep it on the cord there.
Yeah, I was trying to find a cord.
Oh dear. Okay. Well, I am going to share my screen. And I'm being reminded that it's time for the HealthEagle show.
Got it.
We'll go from the beginning. How's that, Mila?
That's better. Do you want to share your screen, or do you want me to share your screen?
Well, I am sharing my screen, so hopefully everybody's seeing it.
Yes, we can see it. Yeah, you can go ahead, just present it from your screen.
All right, super. So one of the improvements that I did make was that I changed the subtitles to Chinese. So for our English speaking folks, we've got the oral, and then for our Chinese folks, we've got our subtitles. How's that, Mila? Working out okay?
Much better. Yes, it translates pretty well. You only can translate your words, not everybody words.
Okay, well, we'll just go ahead and get started and then go from there. Again, this is part 8 of our endocrine system rundown. Today is on the pancreas. Now, we've been going down this path. We did the adrenal gland last week, the thymus before that. And as I was talking with Lynn, we will be doing the testes rather than the ovaries next week. Okay, I figure that the testes would be about a week's worth, and then or a presentation. And the ovaries, I think, is going to take more time, maybe 2 weeks, because we want to get into the cycle. All right. So again, we've got the topics. This is a basic anatomy overview, and talk about hormones and what they do for each of our hormonal glands, or our endocrine system, as it's called, because we want to help everybody learn and have a happy, healthy, and live a full life and enjoy it. And we know that the endocrine system affects the way we feel. So endocrine is made up of glands, and these glands secrete hormones. The hormones then look for their receptors in the body. The hormones are chemicals, and these flow through the bloodstream, and they affect your brain, your liver, your lungs, skin, thymus, just all these places that you need in order to create how you feel. Now, the hormones are, like I said, chemicals. They're transmitted in small amounts from the glands. They go through your bloodstream. They target your organs through target cells, and they're slower messengers. Now, we learned when we talked about the hypothalamus that the hypothalamus links our nervous system and our endocrine system together. The nervous system sends fast acting instructions, whereas the endocrine system sends slower acting and longer lasting instructions to our body. Now, I leave this one in as always, so that it's a background. I like to point out the blue highlighted link that's there. That is for your reference. If you go to that link, you will find a listing of the hormones and the glands with paragraphical explanations. So if you need a reference, this is a very good reference, hormone.com or .org. We're talking about the pancreas today. And the interesting thing about the pancreas is that it is a mixed gland, and it mixes both the endocrine and the exocrine functions of your body. And the endocrine portion of it, the hormones regulate your blood sugar, and the enzymes that are created in the pancreas then assist with the digestive system. So we have both the digestive system and the glucose, or the creation of sugars in your bloodstream, there in the pancreas. Now, an exocrine system, this is an orientation so that you'll understand a little bit better. They excrete substances through their, and in this particular case, the pancreas secretes bile and pancreatic juice, and this pancreatic, through the pancreatic duct to the duodenum, into the gastrointestinal tract, which is your digestive system. Starts with the stomach to the big intestine to the little intestine, then through there you get food intake through the intestines. Now, the duodenum is located just about at the bottom of the stomach. Interestingly enough, the pancreatic juice contains bicarbonate, and this neutralizes the acid that's generated from the stomach entering into the duodenum. And you need to have good pancreatic juice so that you can avoid that heartburn. And I think just about everybody's experienced some heartburn in their life. I, for one, suffered terribly from heartburn for a long time, till I discovered the Prilosec, which suppressed my acids. However, that also suppressed my digestive system, but it was better to have that and not have the pain. And until I started in with USANA, and it was this system that fixed first. So within the first 3 weeks of taking my health pack, I didn't need my Prilosec anymore, which was a godsend because I'd been on it for 21 years by the time I didn't need it anymore. I find that to be amazing that good nutrition can have such a big impact on people, and that it was this that pretty much corrected my stomach ailments when I first started on the program. Okay, so these enzymes that are developed in the pancreas, they're going to break down your carbs, your proteins, and your fats, and there's specific enzymes for each one, and making sure that they go together. So on the endocrine side, you're generating, your hormones are insulin, glucagon, sosastatin, and the pancreatic polypeptide, which is a protein based. And then on the exocrine, you have amylase, protease, and lipids. Now, the protease breaks down protein, breaks down meats and poultry and that sort of thing to get the proteins out. The amylase is going to break down your carbohydrates, and your lipids is going to break down your milks and fruits and that sort of thing. So Mila, I'm going to turn this part over to you. We've got some very short videos to share with you about the pancreas and how it works, and then also problems that you might face with, either in yourself, in your own health history, or as you help other people with their health and helping them achieve happiness by eliminating their discomforts. Take it away, Mila.
Okay, David. Let me share my screen real quick.
Do I need to stop sharing, I think, Mila? You're muted, Mila.
One of the great challenges in this world is knowing enough about a subject to think you're right.
All right, here we go. The first video is the role and not anatomy, but anatomy of the pancreas. Right.
The role and anatomy of the pancreas. The pancreas is an important organ in the digestive system. It is located in the upper abdomen, directly behind the stomach and next to the small intestine. In most adults, it is between 6 and 10 inches long and 2 inches wide. The pancreas is comprised primarily of a network of tubes or pancreatic ducts that release liquids into the upper portion of the small intestine, called the duodenum. Anatomically, the pancreas is divided into 3 regions: the head, the body, and the tail. The pancreas has 2 functions: endocrine and exocrine. Its endocrine function is to produce the chemicals or hormones that regulate blood sugar, such as insulin. Its exocrine function is to produce enzymes that help to digest food. Pancreatic amylase breaks down carbohydrates or starches into glucose. Proteases break down protein into amino acids, and lipases break down fats. Because these digestive enzymes are so powerful, they are wrapped in a protective layer while they are in the pancreas. To reach the gastrointestinal tract, the digestive enzymes travel through the pancreatic ducts and are eventually released into the duodenum at the major papilla, also known as the ampulla of Vater. Once they are completely out of the pancreas, the protective layer is removed and the enzymes become active. Bile from the gallbladder also enters the duodenum at the major papilla. Bile breaks apart fat into smaller fat droplets, which are easier for lipase to digest. When the pancreas is healthy, it contributes to a healthy digestive system. However, when our pancreas does not function correctly and is unwell, we can have trouble digesting food properly or maintaining our blood sugar in a healthy range. The consequences of an unwell pancreas may include diarrhea, bloating, flatulence, oily and foul-smelling stool, weight loss, malnutrition, poor blood sugar control, and diabetes. Heavy alcohol consumption, high-fat diets, eating large meals, being overweight, and tobacco products can put stress on your pancreas, causing it to work less well. There are also some genetic conditions that affect the pancreas, notably cystic fibrosis. To help keep your pancreas healthy, eat a varied diet that is rich in fruits and vegetables. Include fish and white meats as favored sources of protein. Limit high-fat foods and alcohol to special occasions. Maintain a healthy weight, and watch your cholesterol and triglyceride levels.
Good breakdown there, Mila. So we'll just go right into the next one.
Okay.
Oh, Thekla has joined us. Hello, Thekla.
Oh, let me switch the screen. Because the screen only sees 5 people. Okay.
Hello, everybody.
Maybe this one.
You got to get a stool there, Thekla. There you go.
That's too cute.
All right. I like the right to the point of that last slide of that last presentation.
Okay, I just
All right.
open up the videos. Okay, let me share.
Beneath your ribs,
you'll find, among other things, the pancreas, an organ that works a lot like a personal health coach. This organ controls your sugar levels and produces a special juice that releases the nutrients from your food to help keep you in the best possible shape. The pancreas sits just behind your stomach, an appropriate home, as one of its jobs is to break down the food you eat. It aids digestion by producing a special tonic made of water, sodium bicarbonate, and digestive enzymes. Sodium bicarbonate neutralizes the stomach's natural acidity, so these digestive enzymes can perform their jobs. Lipase breaks down fatty substances. Protease splits up proteins, and amylase divides carbohydrates to create energy-rich sugars. Most of those nutrients then get absorbed into the bloodstream and go on to enrich the body. While all this is happening, the pancreas works on another critical task, controlling the amount of sugar in your blood. It achieves this with the hormones insulin and glucagon, which are produced in special cells called the Islets of Langerhans. Having too much or too little sugar can be life-threatening, so the pancreas must stay on constant alert. After a big meal, the blood often becomes flushed with sugar. To bring us back to normal, the pancreas releases insulin, which makes the excess sugar move into cells where it's either used as an energy source or stored for later. Insulin also tells the liver to shut down sugar production. On the other hand, if blood sugar is low, the pancreas releases a hormone called glucagon that tells the body's cells and liver to release stored sugars back into the bloodstream. The interplay between insulin and glucagon is what keeps our sugar levels balanced. But a faulty pancreas can no longer coach us like this, meaning that this healthy balance is destroyed. If it's weakened by disease, the organ's ability to produce insulin may be reduced or even extinguished, which can trigger the condition known as diabetes. Without regular insulin release, sugar steadily builds up in the blood, eventually hardening the blood vessels and causing heart attacks, kidney failure, and strokes. The same lack of insulin deprives cells of the energy-rich sugar they need to grow and function. People with diabetes also tend to have higher levels of glucagon, which makes even more sugar circulate. Without this internal health coach, our sugar levels would go haywire, and we wouldn't be able to digest important nutrients. But like any coach, it's not the pancreas's job alone to keep us healthy. It needs our conscious participation too.
David, we go to the next video.
Yeah, we do that. Just so that everybody will know that their HealthEagle is taking his nutrition from USANA, participating in a healthy breakfast with fruit and protein. Right. Yep. Without the use of greases or anything to fix my eggs. So you'll note that in addition to taking your nutrition, you also need to participate in the lifestyle of healthy nutrition, and that includes the foods that you consume and then also the foods that you do not consume. All right, go on, Mila.
Here we go.
The pancreas. Objective: to learn the structure and functions of the human pancreas. The human pancreas is a pear-shaped gland, which is located in the back of the upper abdomen, somewhat behind and below the stomach. The head of the gland is the widest part and lies in the curve of the duodenum. The gland tapers and extends upward, ending near the spleen. The pancreas is composed of two types of tissues: the exocrine portion, which secretes digestive enzymes, and the endocrine portion, which secretes hormones. Because of its functionality in both the endocrine and digestive systems, it's referred to as a mixed gland. The exocrine portion of the pancreas secretes a pancreatic juice that contains digestive enzymes and bicarbonate. This fluid flows into the small intestine where it further breaks down carbohydrates, proteins, and lipids. Groups of distinct cells called the Islets of Langerhans, named after the 19th century German pathologist Paul Langerhans, are scattered more heavily in the tail of the pancreas. The islets of Langerhans are composed of 3 types of cells, alpha and beta being the 2 primary ones, and delta being the third. In response to dropping levels of blood glucose, the alpha cells secrete the hormone glucagon, which raises blood glucose levels. The beta cells secrete the hormone insulin in response to a rising level of circulating glucose. Insulin regulates sugar metabolism and helps to maintain normal sugar levels in the blood. A low secretion of insulin can lead to an accumulation of glucose in the blood, a situation known as hyperglycemia, and to the metabolic disorder diabetes mellitus. The delta cells secrete somatostatin, which regulates the release of insulin and glucagon. The pancreas consists of several lobules, each of which contains groups of clustered secretory cells known as acinar cells, commonly referred to as acini. The central ducts from the acini unite to form larger ducts, which open into the pancreatic duct. This connects to the common bile duct and enters the duodenum. Summary: the pancreas is known as a mixed gland due to having both exocrine and endocrine functions. The acinar cells secrete pancreatic fluid. The islets of Langerhans secrete hormones. The alpha cells secrete glucagon, and the beta cells secrete insulin.
All right. While Mila's moving towards the next slide, can anybody think of any other exocrine glands in their bodies?
Oh, wow.
Remember, an exocrine gland secretes through a duct. Okay, I'll give you a hint. Mammary glands, they're exocrine. Okay, you have moisture ducts in your hair follicles that secrete oils and all for various different reasons depending upon where the hair is located. So, for instance, your earwax is an exocrine product from the ducts in the hairs of your ears. Okay, for a very particular reason, right? Tears are a product of exocrine system. That's just a few. So on to you, Mila.
It's interesting. I didn't know tear is the exocrine. Good to know.
I have a question before we go.
Yes, sir.
Okay, I was at my doctor and we were talking about the pancreas, and several times they've asked me if I'm diabetic, and I think my family, that's one of the things that we inherited. And one of the things that for us, I have a hard time with sugar, but yet I know my body needs that. So I'm kind of caught in between that. Sometimes it's like my body doesn't want sugar, yet at the same time, I know I need it.
Yeah. Well, it's kind of hard to avoid because the foods do break down into your glucose, and various different foods have different kinds of sugars. Now, in previous presentations, and I don't know if you were with us yet or not when I did these presentations on sugar and the types of sugar, but we do have a on the YouTube a presentation on sugars and 4 different types of sugars that exist. You've got glucose, you've got lactose, you've got maltose. Anybody remember the last one?
Sucrose.
Sucrose. All right. And depending upon what type they are, depends upon how many cells of glucose that are involved. And if you want to know more, Lynn, I'd be happy to discuss those with you, and we can work together to take a look at that previous presentation on that. But if you're eating fruit, for instance, you're getting fructose, and fructose on its own is not good, but the fruit that you're eating has a lot of fiber in it. So that as we were talking about things working together, the fructose and the fiber, you get the slow breakdown of fructose into glucose, which is good because you have the fiber. If you don't have the fiber, then the fructose ends up being a poison to your body.
Okay. I'll go back and review that.
All right. Sounds good. Mila.
All right.
Pancreas. Pancreas is a mixed gland. A portion of pancreas acts like exocrine gland and another portion acts like an endocrine gland. The cells of endocrine pancreas are called of Langerhans, representing 1 to 2% of pancreatic tissue. They secrete 2 hormones, insulin and glucagon. 1. Insulin. The hormone is produced by beta cells of Islet of Langerhans. It is a peptide hormone which plays a major role in the regulation of glucose homeostasis. Insulin promotes the conversion of glucose to glycogen in liver and muscle that is stored in these tissues for future use. Insulin is liberated when the blood glucose levels are high, usually when food is digested and absorbed. If sufficient insulin is not produced, glucose level in blood increases and it is excreted through urine. This is called diabetes mellitus. Diabetes is identified by the presence of sugar in urine. Therefore, diabetic patients take insulin injections regularly. Insulin also affects the metabolism of fats and proteins. Unattended diabetes results in wasting of body tissue, reduced healing power, ketone bodies, blurred vision, and kidney problems. They may end up with gangrene and coma. 2. Glucagon is a peptide hormone secreted by alpha cells of glucagon acts on liver cells and stimulates, resulting in an increased blood sugar, hyperglycemia. This hormone stimulates the process of gluconeogenesis, which also contributes to hyperglycemia. Glucagon reduces the cellular glucose uptake and utilization. Thus, glucagon is hyperglycemic hormone.
So everybody can hear things differently, and of course they receive from are easy to receive information from various different people. So this is a different approach to doing that. But one of the things that I wanted to touch on from this one was the fact that glucagon is a peptide. Does anybody know what a peptide is?
Protein in it.
It's a protein, Thecla. You're absolutely right. And why is that important when we're talking about sugars?
Well, too much protein breaks down into sugars.
Well, that's very true. And we want to remember the lessons that we learned before about insulin resistance. One, how you get it, and two, why it keeps your glucagon from being able to enter in and feed your mitochondria in your cells. And remember, insulin resistance is the where your receptors on the outside of your cells are damaged and they cannot allow the peptide to transfer into the cell. So the peptide or protein type cell can't get across the barrier, right? Where lipids can get across through the cellular boundary, peptides cannot. So there are two types of hormones, peptides and lipids. Now you got to get across that boundary to be able to feed the mitochondria, and it is that peptide that's carrying your sugar. And the insulin is trying to open the door to allow the glucagon into the cell. And if you've got insulin resistance, right, the door can't open, so the peptide can't enter, and therefore the cell is hungry, but you're still eating, right? And so what happens is the sugar's dropped into the bloodstream, the liver tries to deal with it, it absorbs a lot of sugar, and then you end up with high blood sugar, and therefore now you've got diabetes, because now you're washing the sugar out the urine, and which is the indication for diabetes mellitus. How it all comes together, guys.
Yeah.
And it's your pancreas. All right. Next one, Mila.
I wanted to create a video on some unique things about the pancreas and its function and its malfunction. Okay, the pancreas is located underneath the left rib cage. It can also extend over to the right a little bit, but it has the interesting dual function of being an endocrine gland and an exocrine gland. Okay, so it makes hormones, and it can make and secrete enzymes, okay? So insulin, you pretty much know what that is. It regulates the blood sugars, right? It lowers the blood sugar. Glucagon is a hormone that opposes insulin. So what happens, this is triggered when you're not eating, so it does the opposite of insulin. So it raises blood sugar by mobilizing fat to keep your blood sugars level between meals, okay? So, and it's also triggered by exercise and consuming a moderate amount of protein. And it also it's one of the fat-burning hormones, glucagon. But you know what insulin does. Now you know what glucagon does. Enzymes. Every time you eat, the pancreas is a workhorse to produce enzymes to help you digest food, especially if you're consuming more cooked foods or pasteurized foods, things like that, because your body has to break it down. The enzyme lipase, for example, works with bile to help break down fats to the smallest particle. So there's a lot of enzymes that your body makes. One is it's called elastase, which basically is a protein enzyme that helps specifically break down elastic fibers like collagen, fascia, cartilage, that type of thing. And then you have bicarbonates. So bicarbonates are there to help neutralize the acid coming down from the stomach. So it has a little tube, and you got the stomach, you have the small intestine. So that acid coming down there needs to be neutralized because you have like a between 1 and 3, very, very strong pH, and you need to quickly chill that out. So that's why your pancreas makes the bicarbonates to neutralize the acid coming in the small intestine, okay? So there's a condition called endocrine pancreatic insufficiency, okay? That's basically when the pancreas stops making enzymes, all right? So here are the symptoms: diarrhea, loss of appetite, weight loss. So then we have steatorrhea, which is basically your body's not breaking down fats, so the stool is oily and it leaves a little skid mark in the toilet and it has a bad odor, okay? And then you have gas, abdominal or stomach pain, decrease absorption of the fat-soluble vitamins, and it can affect blood sugars. In other words, pancreatic insufficiency can cause type 1 diabetes and even type 2 diabetes because you're decreasing the function of the pancreas. So what happens when you have one part of the gland being dysfunctional, you're going to have the other part too. So when you no longer can produce the enzymes, you're no longer going to produce the hormones as well, okay? Now, I want to talk about the causes of pancreatic insufficiency. So you have cystic fibrosis, which is an inherited condition, which basically starts really blocking the function of different organs: sinus, lung, liver, and pancreas. So that would be one cause. The next cause would be something called chronic pancreatitis. So there's this chronic inflammatory condition of the pancreas, which could be caused from gallstones, because if you block that duct with the gallstone and it backs up, these enzymes back up, those enzymes are so powerful, especially the proteases, they can start dissolving and creating inflammation in its own gland, okay? So that would be one cause. Or there could be a virus or an autoimmune condition of the pancreas, or the person drinks a lot of alcohol, really destroys the pancreas, or high fructose corn syrup. The liver doesn't differentiate between the effects of high fructose corn syrup and alcohol. They're both very, very similar. So consuming high fructose corn syrup is like drinking alcohol as far as the liver is concerned. It creates a lot of liver damage, but it also has something called a cytotoxic effect on the cells of the pancreas that make insulin, okay? In other words, they kill the beta cell. They have the capacity to actually kill the cells that make insulin. And that is a link between high fructose corn syrup and not just pancreatic insufficiency, but diabetes directly. So there's two additional things that go even beyond regular sugar: high fructose corn syrup, which is a type of sugar, or you can have pancreatic insufficiency, which is another cause of diabetes. So there is a huge link between high fructose corn syrup and diabetes. I put an interesting link down below. Check it out. Okay, guys, I'll see you in the next video. Hey, if you're interested in finding...
Okay. All right. Really great from Dr. Bear, so that we can pick up from there. A couple of things. The bicarbonate in soda helps with your digestive system, and this has been known for a long time. And of course, we have in our mineral com bicarbonate right in here, as to help us relax and enjoy and digest while we're sleeping. And then I've always found that a good bowel movement in the morning is very relaxing, and I get one when I use the mineral com. Okay, so in addition to the muscle relaxation capabilities that are in here in terms of your magnesium, and your potassium, okay, you get the bicarbonate. Okay. The other thing that was really interesting about the presentation we just saw was the issue about the high fructose corn syrup. And Len, we were just talking about that. We were talking about fructose, and we're talking that fructose is actually a poison if it's not linked with the fiber. And that is an amazing, linkage. We were just talking about it, and then it shows up in the video, and I just couldn't stand here and not reinforce the fact that in the high fructose corn syrup, what did they do? They removed all the fiber out of the corn, right? So when they processed it to make the oil, they removed the fiber, so they create this poison that now destroys your body. And creates long-term, problems, health concerns, and so forth. So we need to be careful with that. The other component is that high fructose corn syrup and alcohol. They're two different forms of sugar. You got fructose and you've got maltose, but they're both sugar. And the reason why really important here is because there are two molecules of glucose in those. They're not mono. Gauss, Thecla, help me with the term. You got monos and duals, and the ones with dual are more dangerous than the ones with the single
Okay.
Yes.
Polysaccharides.
Polysaccharides. Thank you, Thecla. I knew you. You have the disaccharides and the polysaccharides and monosaccharides and the polysaccharides. Okay. And that is, get you into the sugars conversation again that we were just having. The component of that then talks about the various different issues that can occur in people who have problems with their pancreas. And I know that we have at least one member of our family who has had a great deal of experience with problems with the pancreas, and hopefully we'll get to hear more about that as the presentation goes on. But the component of being able to generate that bile or not, and avoiding blockages and so forth, that's important. And it goes back to a healthy diet. All right, over to you, Mila. Oh, done.
Okay.
Pancreatic cancer, treatment and outcomes. Pancreatic cancer affects the pancreas, a digestive system organ located in the upper abdomen. The pancreas has two important functions. It produces hormones to regulate blood sugar and enzymes to break down food. Treatment of pancreatic cancer is divided into two approaches: curative and non-curative, or palliative. Curative treatment is possible for localized tumors which are amenable to surgical removal. Most pancreatic cancers are in the head of the pancreas. Tumors in the head of the pancreas are removed using a surgery known as the Whipple procedure. In this surgery, the head of the pancreas, the distal bile duct, and some of the small intestine are removed. It also involves some reconstructive surgery. A Whipple procedure is a major surgery that takes 3 to 5 hours and typically requires a 7 to 10 day hospital stay. The operation is best performed by specialized surgeons. If the tumor is in the body or tail of the pancreas, a distal pancreatectomy surgery is performed to remove these parts of the pancreas, as well as the spleen, and sometimes part of the stomach. Very rarely, in the case of large or multiple tumors, the entire pancreas is removed, together with the gallbladder, part of the bile duct, the duodenum, and part of the stomach and spleen. Reconstructive surgery is then performed. Following surgery, chemotherapy is given to help destroy any remaining cancer cells in the body. Radiation treatment may also be used to target remaining cancer cells in the pancreas. Recovery after surgery can be slow. Following a Whipple procedure, the stomach empties more slowly, which can result in nausea, vomiting, feeling full quickly, and poor nutrition. However, this improves over time. As well, infections and leakage of pancreatic juices are common during the healing process. Weight loss over the first 3 to 4 weeks following surgery is typical. If the tumor is not operable, then treatment is non-curative or palliative in intent. Rather than attempting to cure the disease, the goal of treatment is control of the disease, extension of life, symptom relief, and maintaining quality of life. Chemotherapy and radiation may be used to slow progression of the cancer, and medication to manage pain is common. Long-term outcomes following curative treatment vary immensely. Even after successful surgery, chemotherapy, and radiation, pancreatic cancer returns in most cases. Between 15 to 40% of people who undergo surgery live for 5 years or more. However, on average, the cancer returns in about a year, and survival is between 1 to 2 years post-treatment. Nutrition is important in both curative and palliative treatment plans. Decreased appetite and feeling full early are common. As well, the pancreas loses its ability to work well. This may affect how nutrients are absorbed from food and its ability to regulate blood sugar. To help maintain weight and nutrition, the treatment plan may include pancreatic enzyme replacement therapy, PERT, nutritional supplements, and appetite stimulants. Dietary changes to reduce the amount of fat in the diet may also be recommended, as well as increased frequency of small meals or snacks.
So was that supposed to be whole wheat bread? Is that apple? Scary.
Well, I hope it wasn't processed wheat or bleached wheat.
Spam.
Spam. He's a spam.
Sorry.
It's okay.
This is incredible. One of my pastor friends, his wife is just yesterday went in for surgery. They discovered cancer in the colon that went up, and they were talking about that they may have to remove her pancreas or part of her stomach.
Oh boy.
So I will contact them and take them to the site and have them watch this.
Okay. Well, this is the intent of our presentations, is to help you understand and then be able to help others more. So thank you, Lynn, for sharing. And we hope that your friend is improved.
Yeah, we're certainly praying for that. They're very stressed out right now.
Yeah. Okay, Mila.
The last videos, okay.
Chronic
This is the-
pancreatitis.
Yes.
Chronic pancreatitis is caused by long-term inflammation of the pancreas, which eventually leads to the irreversible destruction of pancreatic tissue. Chronic
That's right.
pancreatitis develops slowly over time and is predominantly triggered by lifestyle factors in predisposed patients, such as long-standing heavy alcohol.
Did you have something to add?
Yeah, Mila, we're not seeing I'm not seeing the video. I'm just seeing your screen.
Yeah.
Okay. No? Okay. How about now?
There.
Okay, there we are. Let's go ahead and start from the beginning.
Pancreatitis. Chronic pancreatitis is caused by long-term inflammation of the pancreas, which eventually leads to the irreversible destruction of pancreatic tissue. Chronic pancreatitis develops slowly over time and is predominantly triggered by lifestyle factors in predisposed patients, such as long-standing heavy alcohol or tobacco use, although this is not always the case. Other less common causes are medications that put stress on the pancreas, elevated triglycerides, some autoimmune conditions, and some inherited or genetic conditions, notably cystic fibrosis and hereditary pancreatitis. In some people, the cause of chronic pancreatitis is never discovered and remains a mystery. The pancreas is a digestive system organ that has two important functions. It produces hormones that regulate blood sugar, as well as enzymes to break down food in the digestive tract. When the pancreas doesn't work properly, it affects the body's ability to properly digest food. This means that some people with chronic pancreatitis are unable to get the nutrients they need from the food they eat. They can have trouble digesting food properly or maintaining their blood sugar in a healthy range. This can lead to nutrition-related disease such as weak bones and vision loss. Some people may also have difficulty gaining or maintaining their weight and persistent pain. The hallmark symptom of chronic pancreatitis is abdominal pain. The pain may be intermittent or chronic and is frequently very severe, with stabbing pains localized in the upper part of the abdomen between the belly button and the chest. The pain may radiate to the back and may be triggered by eating, especially high-fat foods. As the disease progresses, the pain may become more severe and debilitating, and often it becomes constant. In some cases, surgery or endoscopic treatment may be required. Oily, foul-smelling bowel movements and weight loss may be seen in the advanced stages of the disease and usually signals exocrine pancreatic insufficiency. As well, depending on the severity and extent of the damage to the pancreas, some people develop diabetes. A combination of tests are used to diagnose chronic pancreatitis. In some people, diagnosis is challenging due to the course of the disease. However, in others, it is relatively straightforward. A CT scan of the abdomen is the most commonly used test. An MRI or endoscopic ultrasound may also be used to confirm the diagnosis. In some difficult-to-diagnose cases, pancreatic stimulation testing can be useful. This test artificially stimulates the pancreas using secretin. This test is expensive and invasive, so it is not frequently performed. Blood tests are not useful for diagnosing chronic pancreatitis. Although there is no cure for chronic pancreatitis, early diagnosis and treatment can help slow the progression of the disease. Treatment involves avoiding triggers, such as heavy alcohol use, smoking, and high-fat foods. Other treatment interventions involve pain management, medication such as pancreas enzyme replacement therapy, PERT, and supporting a healthy diet with multivitamin and mineral supplements.
Okay, so let's recap that one real fast here. Is that we have seen in like 4 videos the discussion about inflammation, and so who can tell me what products that you would recommend to somebody who is experiencing pancreatic, if you know now that a major cause of this chronic pancreatitis is inflammation? Declan, you need to come online. Everybody unmute. Okay. So we're coming on here. We wanted to go ahead and get people to refresh themselves, and remember what it is that the products are intended to do and which ones do which. So we're talking about now pancreatitis, and we're talking about seeing somebody with those symptoms, and now that a major cause of pancreatitis is inflammation of the pancreal duct. What would you recommend for them in terms of nutrition?
Well, they should be on their health pack with a booster.
All right, health pack and a booster. Okay, and why is that, Thecla?
Because they got to have their nutrients.
That's right. They're having a hard time absorbing nutrients. They're going to have help. And what's the one thing that USANA products do better than anybody else's products?
Includes all the nutrients that we need.
Well, it is the right formulation. Well, what are they specifically designed to do?
To go to the spots that need the help first.
They digest. It
That's-
doesn't matter what you take if it doesn't get into the bloodstream. So USANA products are specifically designed to digest. You do not want to leave a USANA product in your mouth and taste it. Okay, and you will taste it because it will dissolve in your mouth. Yeah.
Yeah.
All right. Okay. So you do want to take them with some water to get them out of your mouth and into your stomach as soon as possible. You know, just out of experience, there are some products that are quite tasty. You know, like your probiotic stick pack. You can let that go right into your mouth and you can digest that. They have, you know, the melatonin. You know, you let that dissolve in your mouth. There's several things, but basically your nutritional products, you want to get them into the stomach because they are designed to digest, and the intent is to get them into the bloodstream within 15 minutes. Okay, so according to Ask the Scientist, they will dissolve within 10 to 15 minutes of being in your digestive system. Okay, so that's very, very important, Thekla. Thank you for that, because we got to get those nutrients and macronutrients, micronutrients, vitamins, minerals, okay, the whole lot into the bloodstream, because they don't do any good if they're still in the colon. Right? And that's a big difference between USANA products and most every other product on the market, because the other products don't digest. You're wasting most of the if not all of the product. So that's an important component. All right, what are your nutritional products from USANA that deal with inflammation directly? Go ahead, Mila.
Proflavin C or proglucamol.
Yeah, there you go. Your proflavin C and your proglucamol, right? And what else, Thekla? What else you got?
I would also go with Fructose for the pain and inflammation.
Yeah.
And the ashwagandha.
In the stress relief. Absolutely. The ashwagandha in the stress relief. Those are the kinds of things you need to remember when you're, talking with folks. Is that, you want to help them. You got to remember how to help them. What are those products that are associated with inflammation? And if you don't know, go back and listen to Dr. Chen talk about proflavin C. Okay, it was several years ago, but it still remains one of my very favorite videos from USANA when Adrian Chen gets on stage and relates how proflavin C changed his life. Quite frankly, in the same thing in my life too. I love that. As far as Fructose goes, I'm there with Fructose every step of the way, because you got to get that inflammation attacked, and you get that Fructose into that soft tissue, and it'll take care of it. All right. What else did we learn from this last video on chronic pancreatitis?
There's not much they can do for it.
They say you can't cure it, but David, can you tell me a little bit about how nutrition has benefited your life?
Oh, it's benefited my life.
Yeah, in terms of the chronic pancreatitis that
That Gwyn had.
That Gwyn had.
Gwyn, well, hers was something. Yeah, she had that.
She had the tuberculosis, which caused a lot of inflammation.
She's right here. She can tell you.
Sure. Gwyn.
Yeah, what works for
Yeah, we are talking about the pancreas. Gwyn.
Digestive enzyme. Good for pancreas.
Yeah. So are you okay with talking about your pancreatitis and your tuberculosis?
Fructose is need a medicine. Medicine kill the bacteria. But meanwhile, you have to improve your body immunity. In body immunity, the nutrition, well, I think healthy pack. Healthy pack pro-glutamine. Proflavonol C.
Pretty much what we talked about.
What
That's what we talked about, yeah. And I just wanted to refresh that, because we do have, you know, this experience in our family that you know, we can take and know about and learn that how nutrition works. Because Gwen was clearly suffering from malnutrition, from lack of nutritional benefits. So when she started with the health pack, she started getting the energy back. And with the other products was able to deal with the inflammation and the pain and suffering. And you know, quite frankly, we have the benefit of USANA that has brought Gwen to the family, and then thus David. So wanted to make that direct relationship here with the products, with the illness, so that we can then take this knowledge and help other people.
Does
All right,
that
so
does detox tea help with that inflammation or your digestive system?
Your detox is going to help with your inflammation, but it's going to carry the poisons out of your body. It's going to help with the kidneys and the liver, bring the toxins and poisons that exist in your body and flush them out. And so we do know that when you start in with USANA, many people, most of us, have experienced what we call various different forms of detoxification. And we've had it in terms of body fluids. We do, you know, some people through sweat, some people through their exhale, right? Some people through the urine and their stools, right? So we have also the gases associated with sometimes, you know, the startup of using shakes. You get USANA gas, as we colloquially refer to it, in order to help you in your detoxification process. So yeah, you're absolutely right, Lynn. Your detox tea will help you, and you know, if your pancreas isn't working, you're going to have a lot of poisons in your body. And some of those poisons your body's generating themselves.
Mm-hmm.
Mm-hmm.
All right.
Do you want to summary up a little bit?
Yes, we want to go ahead and summarize up. Go to the next slides. Go back to slides. I guess you can share back to me, or you can go to the next one. Yeah. You know, we wanted to go back and say, okay, diet. Yeah. So diet is incredibly important. As Jishi likes to say, you have to control your mouth, and you also have to know what best benefits your body to get to having healthy glands, so that they're generating healthy hormones. And now the reason why we've been doing hormones in the endocrine system is to make this tie between nutrition and relationships, or nutrition and feelings, behaviors. And once we get into feeling better, behaving better, we will have more strength to engage in healthy relationships. Now we've got, next slide. There we go, next class. All right, so we already talked about this early on. we have 2 glands left, the ovaries and the testes, and we'll be doing the testes next week. Next week is the 29th of January.
Oh, it will be warm.
Yeah, just think warm, and then we have the beginning of Chinese New Year, and 14th, 13th, the 11th, 12th of February. That's for you is 11th, for me is the 12th. We're going to take that week off, but we will do next week, the 29th. Then Chinese New Year starts on the 1st and goes through the 15th. And this family will be taking that weekend of the 15th, the 12th, 13th, 14th, 15th as a holiday, and enjoying some more of Thailand that we would not normally get to see on a weekend.
Sounds like fun.
It will definitely. Yeah. So
I think Lady likes you a lot, David.
all right.
So
don't forget, we do record these, and they do get placed onto HealthEagle. Share them with your friends, and help other people understand their bodies and their nutritional requirements so that they can feel as healthy and happy as you do.